Let's have a look at what happens in the normal pain pathway. Pain receptors are stimulated by injury and trauma. A pain impulse travels along the pain nerves to the spinal cord. Here it is processed by many different cells in the back of the spinal cord. This area is called the dorsal horn. The dorsal horn is an important processing center. Eventually, after processing, a pain nerve impulse travels across the spinal cord by the interneuron. The interneuron connects with another neuron in a pathway called the ascending tract. The ascending tract takes the pain impulse to the brain, to another processing center in an area of the brain called the thalamus. The thalamus makes important connections with another area called the limbic center, which is involved in emotion. This is why pain is so closely tied in with emotion. After the impulse has been processed at the thalamus and the limbic center, it is passed upward to the outer part of the brain, called the sensory cortex. This is where we perceive the impulse as pain. At the same time, the brain is sending information down a pathway called the descending tract to the processing center at the dorsal horn, where the pain impulse first entered the spinal cord. The descending tract can have a powerful inhibitory effect on the pain impulse passing along the interneuron. For example, when someone is in a fight, they will often say they did not feel the punches when they landed, but only afterwards. This is because we can suppress information passing along the interneuron. This is a protective mechanism. By suppressing the sensation of pain at the time the punches landed, we are able to get away from the danger. If we were left incapacitated at the moment of the punch, we may expose ourselves to more harm. Let's have a look at what happens in the pain pathway when pain becomes chronic. In chronic pain, pain impulses are sent repeatedly and unremittingly to the spinal cord. After some time, the processing center in the dorsal horn stops working properly and sends impulses of its own along the interneuron. So the generation of the impulse becomes automatic at the level of the dorsal horn. This is called the centralization of pain, or wind-up of the dorsal horn. The impulses generated at the dorsal horn, although located within the spinal cord, are projected as if they come from the outer area of pain. In our example, the foot. This leads to an increase in the pain intensity. The other area where things change in chronic pain is the area where the ascending tract links up with the thalamus area of the brain, the other processing center I mentioned earlier. The thalamus processing center also stops working properly, and it becomes difficult to handle emotions properly. This plays an important part in the fear, anxiety, and depression often associated with chronic pain conditions. This area is also linked to the sleep-wake center, and this is why so many patients find it difficult to get proper, restful, refreshing sleep when they have chronic pain. If we don't sleep properly, we are less able to cope with being in constant pain, and the ability to fight pain becomes eroded. The descending tract in chronic pain can also play an important part. If we are feeling anxious, depressed, and fearful, in a very real sense, at a neurotransmitter level, there is an increase of impulses to the interneuron at the dorsal horn. If we feel supported, understand what is happening to us, feel we can do things to control our pain, then in a very real sense, we can reduce the amount of neurotransmitter that lead to impulses passing along to the interneuron. If you are living in chronic pain, somewhere on this pathway, to some extent, this is what is happening to you.